exciting edition on my channel. On today's edition, we are going to be talking about some common mistakes that should be avoided during pregnancy. Exciting, right? But before I delve into this exciting topic, please subscribe, hit the notification bell so that you'll be notified earlier when any video comes up. Like, comment, and share this video. During pregnancy, a lot of information is passed on to the mother because the fetus or the baby is at risk. Some of this information could be false. Some of them could also be true. The first mistake that should be avoided during pregnancy is the consumption of alcohol. Alcohol of any amount during pregnancy should be avoided. When a mother during pregnancy takes in alcohol, it is absorbed in the blood and passed through the umbilical cord to the fetus. Alcohol can cause miscarriages, stillbirth, premature labor. It is also thought to cause a wide range of developmental, mental, and physical disorders in what we call the fetal alcohol spectrum disorders. So yes, alcohol of any amount during pregnancy should be avoided. Then also, eating of anything that has little or no nutritional value should be avoided during pregnancy. My ladies or pregnant women, please desist from taking some of these things. They are thought to affect the development of the fetus. They can also cause infection. Medically, these cravings, we call them PCAP. When you are pregnant, the desire to take in these things increases excessively. But please try as much as possible to desist from some of these things. Smoking during pregnancy should also be avoided. Smoking is a red flag. It's a no. Smoking cigarettes contains an addictive substance we call nicotine. Nicotine is an addictive substance that causes or can affect the brain and the lung development of the baby. So smoking should be avoided. Please do not smoke during pregnancy. Taking of unprescribed medications and herbal preparations during pregnancy should also be avoided. There are certain medications that can adversely affect the development of the fetus. So if you are experiencing any headache, any stomach pains, you are having any signs and symptoms during pregnancy, don't be in a haste or rush to the over-the-counter and then buy some of these medications, because you end up putting the development of the fetus at risk. With regards to the herbal preparations, yes, I believe and I know there are some herbal preparations on the market that have been Food and Drugs Authority certified. But before you take them, please consult your physician. With regards to exercises, please do not engage in strenuous exercises or the lifting of heavy objects during pregnancy. It should be avoided. This does not mean that during pregnancy you should lazy around. Of course, you can walk, you can go to the market, you can cook, but the lifting of heavy objects or strenuous exercises during pregnancy should be avoided because they can affect the baby or the fetus. It can weaken the muscles at the pelvic floor and cause miscarriages eventually. Last but not least, I want to talk about the sleeping position every pregnant woman should assume. The best position is on the left lateral side. You should sleep on your left lateral side when you are pregnant. To increase the comfortability, you can put a pillow in between your thighs. It's also good. But aside this position, do not sleep on any other position, your back side or your right hand side especially. Sleeping on your right hand side laterally can affect the development of the fetus adversely. For instance, when you sleep on your right hand side laterally for a very long period of time, you put pressure on a vein we call the inferior vena cava. This vein carries blood to the fetus and to the heart of the mom. So eventually, it limits the blood flow to the fetus. So the fetus cannot get enough oxygen or nutrients to help its development when it is in the uterus. So in the long-term run, there could be fetal demise, that is the death of the fetus. So please, the best position, as I said earlier on, is on the left lateral side. I want to address this information with regards to the consumption of pineapple. There have been reports that people who consume pineapple fruits or pineapple juices end up losing their babies. There is no enough scientific evidence to support this claim. Yes, there is an enzyme in pineapple called the bromelain. Bromelain is a proteolytic enzyme and it is found in pineapple. It can also be given as medication, but the amount of bromelain that can cause miscarriages is not sufficient or is not enough in pineapple. So yes, if you are pregnant, you can consume your pineapple fruits or juices in peace. There is no problem with that. Unless, of course, you have any gastrointestinal problems like vomiting, diarrhea, stomach ache, and what have you. Yes, then of course you can consult with your physician or dietitian and change to any fruit you are comfortable with. Aside that, eating of or consuming pineapple is safe, completely safe during pregnancy. I believe you have been well informed. Some of these mistakes can be avoided and should be avoided when you want to have a fruitful pregnancy period and have healthy babies. Don't forget to share these videos. You could be saving lives. Subscribe to this channel. Hit the notification bell. Like and comment. Thank you. Till I come your way the next time with another exciting episode on information about your health. Please stay healthy.